In Kenya, early pregnancy continues to disrupt girls' education, with the Kenya Demographic and Health Survey 2022 showing that 15% of girls aged 15 to 19 have begun childbearing, including 12% who have given birth and 3% who are pregnant, and many never return to school due to stigma and limited support. The SHE SOARS project, implemented in Kenya, Uganda, and Zambia, supports out-of-school girls with services, skills, and pathways back to education. This is a story of resilience and second chances, ensuring policy becomes reality and no girl is left behind.
When we were starting out the project, we realized a direct correlation between literacy levels and SRHR outcomes for this particular age group. Hence, we sought to find a way to bridge the gap by advocating for the re-entry and reintegration back to the formal education system, alongside advocating for the reproductive health and rights. Under this, we sought a collaboration with the National Ministry of Education to evaluate the place of the School Reentry Guidelines 2020, which are anchored in the 1994 School Reentry Policy, and also see how to accelerate its implementation to ensure these girls go back to school. We've been able to do a number of things with the ministry, part of which was an impact assessment we did in Kisumu to ascertain the work that we're doing in the communities and also to ascertain the need for accelerated implementation of this particular policy. After that, we were able to do a lot of other consultations within us, and the ministry released a circular which provides guidelines to all stakeholders within the education ecosystem, as well as health, interior, and other stakeholders on how to ensure that these girls get back to school.
One of the major things within the circular is to ensure that there's coordination amongst the different relevant departments within the ministry. And so this circular is directly addressed to the county directors of education, the regional directors of education, the sub-county directors of education, and even going down to the school heads. And ultimately, this will benefit these pregnant and parenting learners who are outside the school but also within the school setup. The circular is very clear in its directive and it's a binding document, and so we are relying on this enforcement and directive of the Ministry of Education to ensure that the guidelines, the 2020 school reentry guidelines, are actually implemented but largely also disseminated, and these relevant bodies and departments are aware of their different mandates, they are aware of their scope of their mandate and their roles as well. So it is a very comprehensive circular that we drafted together with the Ministry of Education to just align and ensure that all these players, even right at the Ngaos, the national government administrative offices at the community, are also part and parcel of these directives.
We are out, one, to take care of the ones that are already out of school and bring them to school, and ensure that the pregnancies that have not occurred do not occur, so that the increase or the rise that we are noticing now, we start experiencing a decline, and slowly we will reach the level where we have total elimination. We want to end teenage pregnancy because it's a problem that we can do away with. It's unnecessary. It is an abuse of children. It is an abuse of human rights, because these children have not reached an age of responsibility age where they can handle this kind of responsibility. And so that is our commitment as Minister of Education, to ensure that every opportunity of education is reached to all children, irrespective of their backgrounds, and all these children access education as stipulated in the Constitution and according to the SDG 4 and our National Education Sector Plan, where access, equity, retention, including quality of education is assured to all children, irrespective of their background.
The Center commitment to supporting access to education, which we consider highly as a right to education, is a commitment that the Center for Reproductive Rights, CRR, we continue to work with our partners. One of the advocacy priorities for Kenya and the SHE SOARS project has been to ensure that there is access to education, and not just access, but retention, transition, and completion. and we consider these as a critical, essential elements within the human rights. Critical to this process was the signing of Return to School circular by the Minister of Education on 29th of January, a critical policy reform which will have an incredible impact among Kenya's pupils, but largely the pregnant learners and the mother learners. Those are already either breastfeeding and they want to go back to school. The re-entry has 8 provisions, and these 8 provisions speak to the right issues around access to education, especially ensuring the vulnerable or the pregnant students who are left at school because of pregnancy, they actually have access to go back to school. The circular was signed, and we are happy with that critical milestone. But just having signed it was one thing. An essential component, and the next milestone was to ensure that a technical working group, which bring multiple agencies of the government, bring together civil society, the media, and all actors in the education sector, are able actually to come together and support 2 processes. One is support the dissemination of already signed circular, and secondly, to support the implementation, full implementation of the circular. And that's where we have been working closely with the Minister of Education and different directorates, the directorates of KEMIS, the Kenya Education Management Information System, the Police Service, the Service Commission, the Gender Department, Directorate of Children's Department, because all these government agencies and departments have a role to play in supporting not only dissemination of already signed circular, but also the aspect of the implementation. This is what we've been working on SHE SOARS project, and generally part of the advocacy programs at CRR, and we hope by doing this, 13,000 students, all pregnant students who dropped out of the school, will have a huge number of them coming to school. Currently, only about 10% are returning school, and we want to push that number from 10 to 45 and eventually about 75, ensuring a big component of the 13,000 students who drop out of school annually because of pregnancy, they are actually able to come back and pursue their career, pursue their education. So it's about education rights, it's about access, retention, and completion.